As a paramedic, how is a community paramedicine response different than a traditional run?
So for a regular 911 call, the paramedic always has in the back of his or her mind that the patient is ultimately going to go to the hospital. The paramedic may provide some pretty sophisticated treatments, some pretty sophisticated diagnostics, but ultimately the responsibility for what happens rests with the emergency department when that patient's transported. Community paramedicine is different. In community paramedicine, we're not looking to transport the patient to the hospital. Instead, we're looking to come up with the best plan for that particular patient, which often involves just treating them at home. So the paramedic can provide some of the same advanced treatment, but with a different goal in mind, and that's the main difference between the two.
Can you name one or two reasons why community paramedicine may be attractive to paramedics?
Right, so I think it's attractive to the regular 911 emergency paramedic because of the opportunity to be involved in more of the definitive care for the patient. Again, like I was saying, the traditional paramedic is doing things on scene, but then taking the patient to the hospital. In this situation, the patient and the paramedic are working together with a physician who's working remotely to come up with kind of like the best plan for the patient. And the paramedic may be the only clinical provider who actually examines the patient and treats the patient during the course of the call. And I think that added responsibility makes it interesting, makes it attractive to the traditional paramedic.
And what has been most rewarding about being a part of this innovative program for you?
So our particular program is somewhat different than some of the other community paramedic programs in the country in that we're not providing pre-scheduled paramedic visits, right? We're not trying to replace visiting nurses. We're not trying to replace in-home physicians. What we're doing is we're providing kind of an urgent assessment, something that's kind of between a scheduled visit and a 911 emergency. And I think that kind of like hybrid makes our particular program pretty interesting and somewhat unique.